Ebola in an American's eye. An American who had been given a clean bill of health after being hit with Ebola suddenly was in great pain. He found out the Ebola was still alive and in his eye. Here's what we know. Dr. Ian Crozier was hospitalized in Atlanta in September with Ebola. In October, he got that clean bill of health. He was back out in public living his normal life. And then 2 months later, he was back in the hospital. His left eye was in great pain. His iris had turned from this blue that you see here to green. And as you can see, the pupil had dilated incredibly, so you could barely even see the ring around it. And tests showed that while his blood was declared Ebola-free, his eye, that eye, was still full of the virus. Our chief medical correspondent, Dr. Sanjay Gupta, is out front. Sanjay, this is a bizarre story. It's a frightening story. I guess the first question is, he gets this clean bill of health. 2 months later, the Ebola's in his eye. How was it able to survive? And was it alive the whole time in his eye? Did it migrate there? I mean, what do you know?
Most likely it had been in his eye all along. The interesting thing about the eye, along with a few other parts of the body, is that they're sort of immune privileged, meaning that immune cells, the cells that fight infections, have a hard time getting to certain places. They can get there, but in much smaller amounts. So Ebola, the virus, or it could have been any virus or pathogen, if it gets in the eye, sometimes the body has a harder time clearing it. That can happen in certain parts of the brain as well, in your cartilage. So likely, Aaron, he had that infection from the beginning. It's not in his blood anymore, which is what gave him that clean bill of health that you mentioned. But because he started having these symptoms, they actually put a needle into his eye, and when they pulled back some of the fluid, they found the Ebola virus in that fluid.
So you're talking about places in the body. I mean, this is incredible that it's hard for immune cells to get to. Things can survive in. You mentioned cartilage, parts of the brain, the eye. I mean, when this doctor, you know, and as this country was told, this doctor was healthy, back in public, no longer contagious. Obviously, they didn't know or expect that the virus would be in his eye, but it was. I mean, how can they know that he wasn't a risk to others around him if the Ebola was still there?
Yeah, it's a great question, and you know, it's a question that we put directly to the doctors who did this procedure, who put the needle into his eye, because they were the ones who obviously had the most contact. I should mention, first of all, that we've known about the possibility of Ebola lingering in the eye for some time. Even back in the outbreak of 1995 in Africa, there were some patients who subsequently were found to have the virus in their eye even a couple of months after they were declared Ebola-free. So it wasn't entirely new. But what these doctors did was interesting. They around the tear duct, they took some of the tears and some of that area and looked for the Ebola virus first before they did the tap. And they did not find any Ebola virus there. After they did the tap, they did find the Ebola in the eye itself, but after that, they looked at the tears again, and they didn't find any Ebola. So they're very confident that he's not contagious, that he's not spreading this virus to other people. So that, you know, that from a public health standpoint, that was really important.
Very important. Now, his iris, as we saw, went from blue to green, and obviously the pupil dilated significantly, right? It was almost as if you'd gone to the eye doctor, right? It became all black, and then just that little green. So that's the normal, and then that's what happened to his eye. Why would that happen?
You know, it's interesting. We asked the ophthalmologist this, and they say it's a bit of a medical mystery. You know, it's interesting, Aaron, you'll appreciate this because you have blue eyes, but you may know that blue eyes, basically, you don't have any pigment, any melanin in the eye. So when light is shining into your eye, it just refracts, it disperses, and that's what gives it the blue color. People who have darker eyes, like me, for example, you have a lot more melanin. Could it have been the virus itself you know, causing some of that pigmentation of his eye, and then when the virus cleared, his eye started to go back to a more normal color? Typically, what we hear is that this does happen, where the eye changes color like this, it usually stays that way. In his case, it went back to its normal color. It could be some indication that the amount of Ebola virus has gone down. But it is kind of remarkable to look at those pictures.
It is, as you say, a medical mystery. All right, Dr. Sanjay Gupta, thank you so much.
You got it, Aaron. Thank you.